So citizens should brace themselves for a hike in what they pay for. Already we've seen this. Last year I had so many instances. People first complaining that the health insurance card was not delivering much and that they were paying more and more, especially in private facilities and even in public ones. And you're saying we should brace ourselves for more. What does this add to the picture? Just to give another compliment, and I forgot. When you see those, I've forgotten the proper name for those overhead lights used for surgery and the rest. There are places without them, which have been without them for a long time. Sometimes people have to use phones and their lights to perform surgery, like we've seen in some areas, not just rural areas. And that's not to say it is okay in the rural areas. But what is your thinking, Dr. Asiedu, as we wrap, on the very quick migration of Ghanaian health workers to other countries, especially the UK, Canada, the US, Australia, among other places? The numbers have been growing. I remember, I think it was the first quarter of either 2022 or 2023, 3,000 of our nurses had left, and the flow has continued. Now, some have proposed that we could go the way of the Filipino or the Philippine example, where they actually allow a quota of their health workers to go abroad. I think it is Professor Peter Quote of ISSA, to go abroad, and then they ensure that they send remittances back to the country. So it's a sort of arrangement, and then they are bound to send some remittances or pay certain fees. Do you think that could work in Ghana's case, or are we sitting on a ticking time bomb?
You see, I've looked at the Filipino model, and the Filipino model is similar to the model that you have in Cuba. In fact, that health as a revenue driver was first started in Cuba, ironically, in a communist country. And so for a long time, if you look at the successful Brazilian universal health coverage model that a lot of people tout, you'd realize that a lot of the doctors that went in there were Cuban trained. For you to do that, you have to overtrain. What do you mean by overtrain? You know, the WHO has health professionals to population ratios.
Right.
So you need to have a health professional to population ratio that is higher than your country's requirement. So you have a surplus. You cannot export something you don't have. If you did that, then you're going to go into what happened to China when they had the Cultural Revolution, when they were sending grain abroad while people were starving in their country. That you cannot do. So yes, on paper, it is a plausible way to go. Plausible because you can make up your mind to overtrain just to export. We are not doing that. So that strategy is untenable at the moment. It's not that it's not feasible, but it's untenable at the moment because our health professional to population ratios are woefully inadequate. I can give you a few examples, and you realize that they are woefully inadequate. So for me, if you want to do these things, then we have to start planning. And without planning, we cannot do that.